Have you ever wondered what exactly those squiggly lines and symbols on a hearing test chart really tell us about your hearing? It might seem like a lot of technical jargon, but understanding two key measurements, air and bone conduction scores, unlocks a clear picture of your auditory health. Air and bone conduction scores are two vital measurements in a hearing test, providing distinct insights into how sound travels through your ears. They tell us not just if you have hearing loss, but more importantly, where in the hearing pathway the problem might be located. Think of sound traveling into main ways to reach your inner ear, which is where the brain processes sound. Air conduction measures how well sound travels through the outer ear, the eardrum, and the middle ear bones. This is the natural path sound usually takes. Bone conduction, however, bypasses the outer and middle ear entirely, sending vibrations directly to the inner ear through the bones of the skull. By comparing these two pathways, audiologists can precisely pinpoint whether a hearing difficulty stems from an issue in the outer or middle ear, or if it involves the inner ear or the auditory nerve itself. During your hearing test, an audiologist will use headphones for air conduction testing and a small vibrator placed behind your ear for bone conduction testing. The scores are then plotted on an audiogram, which is a graph that visually represents your hearing thresholds at different frequencies or pitches. If your air conduction scores show hearing loss while your bone conduction scores are normal, it suggests a conductive hearing loss in the outer or middle ear. This type of hearing loss often responds well to medical treatment or surgery. However, if both air and bone conduction scores show hearing loss to a similar degree, it indicates a sensorineural hearing loss, which typically involves the inner ear or the auditory nerve. When both types of hearing loss are present, but the air conduction scores are worse than bone conduction, it is called a mixed hearing loss. Understanding these scores empowers you to have a much more informed conversation with your hearing healthcare professional. It helps you grasp why specific treatment options, like hearing aids or perhaps medical interventions, are recommended for your unique situation. This knowledge is not just about the numbers. It is about providing clarity on your path to better hearing. For instance, a significant gap between your air and bone conduction scores, known as an air-bone gap, is a strong indicator of a conductive component to your hearing loss, signaling that there might be a physical blockage or a problem with the tiny bones in your middle ear that could potentially be corrected. Ultimately, air and bone conduction scores are crucial diagnostic tools that help identify the exact nature and location of any hearing impairment. They transform a general idea of hearing loss into a precise map, guiding personalized care and ensuring you receive the most effective solutions to improve your ability to hear and connect with the world around you.